A private equity firm walked into communities across America, bought their only hospitals, promised to save them, and then started shutting down emergency rooms. That's not a rumor, that happened. And the firm that did it had a name straight out of a villain movie, Cerberus Capital Management, named after the three-headed dog that guards the gates of hell. I'm not making that up. In 2010, Cerberus dropped over $800 million to acquire Steward Health Care System, a network of hospitals mostly serving working-class communities in Massachusetts and beyond. They called it a turnaround investment. They promised efficiency. They promised stability. What they delivered was something very different. Here's how private equity works in healthcare. You buy a struggling hospital network cheap. You cut costs fast, staff, services, supplies. You sell off the real estate the hospitals sit on, then lease it back to the very hospitals you own so they're paying rent now on buildings they used to own outright. That's called a sale leaseback, and it's completely legal. It's also one of the most predatory financial moves in the playbook. Steward did exactly that. They sold hospital properties and used the cash to look profitable on paper. But now those hospitals owed millions in rent every single year, rent that drained money away from doctors, nurses, and equipment, and when the bills piled up, something had to give. What gave was emergency rooms. Between 2017 and 2023, Steward closed ERs in multiple communities. Think about what that means for a second. Not a coffee shop, not a mall store, an emergency room, the place you go when your heart stops, when your kid stops breathing, when you don't have time to drive an extra 40 minutes. And these weren't wealthy communities with options. These were towns where Steward's hospital was the hospital, the only one for miles. In 2022, a study published in Health Affairs found that ER closures directly increase mortality rates in surrounding communities. People die because the ER is gone. That's not speculation, that's peer-reviewed research. So what was Cerberus focused on while all this was happening? Returns. By 2021, nearly 30% of hospitals under private equity management were experiencing significant financial distress. 30%. These were supposed to be the efficiency experts, the financial geniuses who were going to make healthcare run like a business. Instead, they ran hospitals into the ground while extracting as much cash as possible before the walls caved in. And here's where it gets really dark. Steward Health Care eventually expanded massively, growing to operate hospitals in 9 states, 36 facilities, each one going through the same playbook. Buy, cut, sell the real estate, lease it back, squeeze the margins. By 2024, Steward was in full collapse, filing for bankruptcy, billions in debt, hospitals threatening to close entirely, staff going unpaid, nurses walking off floors because they hadn't received their last paycheck. And Cerberus, they had already largely moved on. They made their money on the way up, on the asset sales, on the financial engineering. The communities left holding the bag were the ones who never had a vote in any of this. Nobody asked the patients, nobody asked the nurses, nobody asked the towns if they wanted their only emergency room turned into a line item on a private equity balance sheet. Dr. Eileen Applebaum, co-director of the Center for Economic and Policy Research, put it plainly. She said private equity's focus on short-term profits often undermines patient care and long-term sustainability. That's the polite academic version. The real version is this. They knew exactly what they were doing. You don't accidentally sell a hospital's building out from under it. You don't accidentally close emergency rooms. These are deliberate financial decisions made by very smart people who understood the consequences and made the calls anyway, because the consequences landed on patients, not on partners. This is what financial crime looks like when it's technically legal. No one's going to prison for closing an ER. No one's going to prison for the sale leaseback. The paperwork was clean, the lawyers signed off. But communities lost their lifelines, workers lost their jobs, and patients lost access to emergency care, all so a firm named after a hellhound could hit its return targets. The next time someone tells you private equity is just good business, remember Steward, remember the ERs. Remember that $800 million bought a promise and the communities paid the real price. Follow this channel, because the most dangerous crimes aren't the ones with ski masks. They're the ones with term sheets.